Good morning. Welcome back to Daybreak. And it's time that I want us to speak to two doctors. One of them is a virologist. The other one is a critical care doctor. But before we do that, let's take a look at the numbers and the trends that we've seen in the past few days to weeks and months. And we begin with looking at the state of the pandemic at the moment. I want us to begin by looking at the total infections being at 17,603. Those that have died are 280. The recoveries are 7,743, and therefore the active cases are 7,997, just 3 shy of 8,000. The total tests, the samples that have been tested so far, 276,000. Let's take a look at something else that we need to know in as far as the numbers are concerned, that the past 1 week has been the worst week because as we were starting the week, we were at 13,353 infections. As we closed the week yesterday, that is actually that date should be 26th July. There were 17,603, and therefore the increase has been 4,290. The new deaths have been 46. It's not the highest in terms of deaths, but it is the highest week in terms of the new infections. Then the new recoveries, 2,621, again a week of records because that is the highest number of recoveries in a week. Then beyond that, we also know that, yes, like I said, it's a record week because the samples tested at 32,000, the infections are 4,250, and therefore that becomes the highest positivity ratio, which is at 13%, meaning the total infections vis-a-vis the samples tested. Then for the month of June, we had an infection ratio or positivity ratio of 4.9%. The deaths then were 82, but I want you to compare this number to what we have now in July, because we had 4,404 infections reported in the month of June, but in the month of July, with just 26 days into it, we now have 11,237. You see that how it compares with the 4,000 there. So it appears the positivity ratio for the month of July is at 10.5. The deaths already higher than the month of June because they're at 132. We'll be raising the questions why more people are dying now. Let's move on to let's take a look at the other numbers, because it's becoming a very biased infection, if I may say so, because out of 17,000, it is only 6,082 women that have been affected, or female have been affected. That is the 34.5%. So the two doctors will be telling us why the pandemic appears to be targeting men, and because now the men are at 65.5%. Let's take a look at something else. In terms of the trends since week 7, so look at that curve. It's been rising. We've been told that we're approaching the peak. We do not know whether we are reaching the peak now, but look at how it has been moving from week 14, when we hit 1,000 infections per week, to now at 4,000. In a span of just about 5 weeks, we've turned from 1,944 every week to 4,250, and you see it's been a record, because week 16, 16 cases were reported. The following week we reported 2,219, then 3,245, then 4,250. So will next week be reporting 5,250 or 260? We don't know, but you can see the trends for yourself. Time will tell us. Now, if you look at the county's caseload, this is how they are looking. Nairobi leading with 10,000, Mombasa 1,900, Kiambu 1,100. You can imagine that Kiambu now, which was trailing the country way before reopening, now it's at number 3 and approaching to beat Mombasa very soon. So look at the rundown of those numbers. Let's move on to another slide to look at excuse me, the total new infections. This is since reopening, which we'll be looking at later on as we have the conversation about the meeting between the president and the governors. There's something else we need to look at. We'll come back to this later, but for now, let's take a look at this. Kenya's worst month. This has been the month of July. You look at how the numbers have been behaving. Currently, the daily average in the 26 days of July is 432 and has been rising consistently. Compare that to June, when we had 147. I want to begin with the two doctors, Dr. Ngani and Dr. Masika. Good morning, both of you. And when you look at these trends, the numbers that you are reporting, I want to begin with you, Dr. Ngani, because this is the first time you're on this show. What are you learning? Because those trends appear like July will go down in record as the worst month, maybe, so far. What is happening?
I don't expect July to go down on record as the worst month, because I think these are just the early months, and most likely worst months are coming forward, because if you look at the trend of COVID-19 across the world, then the first few months seem to be very mild and very sort of a sedate way of spreading. But then once community spread catches on, then there is this exponential rise. And what we are seeing now in the month of July is basically a prelude to what we would expect in the subsequent months of August and so on. And remember, as we upscale our capacity to test, then we see greater numbers. And I think these kinds of conversations need to be had for people to understand how serious COVID-19 is, because certain challenges that I'm sure we'll talk about in the course of this show begin to show themselves in very, very real ways that impact life.
Mm-hmm. And Dr. Masika, I remember the last time we spoke to you, the numbers are not as high, but the rise has been very consistent. And we were told that we have started ascending to the peak. Where are we now in terms of the peak analysis are concerned?
Yes, the numbers, I think, will continue to rise. I don't think we can say right now when the peak will be, because there are many things that can change that, especially our behavior and our movement habits. So I cannot say for sure when the peak will be. I know people have modeled and it was expected in September. That could change because each day we take different actions to try and control this, and all these actions will keep pushing these days either further or keep pushing the numbers down. But for now, what we can see is that the recent, as expected, the recent reopening was going to have an increase across the counties. And we are seeing that now as in the numbers. And I think for the next few months, if not weeks, we are going to have the same increase reflected. So I can't say now when the peak will be, but it's not yet, we are not yet there.
We are not yet there, but Dr. Ngani, so we've been told that Mombasa's numbers have sort of reached a plateau because the rise has not been as significant compared to other counties. Where are we in Nairobi? Because the numbers keep rising. Now we're at more than 10,000. Yesterday we reported 510 infections. I don't think that's the highest in Nairobi. What do you expect to see in the coming days with all this community transmission going on?
Maybe the first thing I'll talk about is the question of reopening. Now, reopening definitely affects counties other than Nairobi and Mombasa, which were probably the most affected early. And you can still see that despite the reopening, Nairobi has been rising quite a bit. And this exponential rise is the sort of graph that we'd expect in other countries. And I think we need to understand that with or without reopening, areas like Nairobi were at particular risk. And what we're seeing right now is not as a result of that. It's because of the natural progression, natural spread of the disease. Secondly, if you look at Mombasa County, the response across the world has been different. And I think there are times when you have to give credit where it's due. And there was a lot of presence, a lot of positive efforts within Mombasa County. You could see that the county government had put together the specialists in that particular area, and they'd made genuine efforts to sort of mitigate this issue. And I think the national government also supported. And across the world, where measures are firm and they're early and they're elaborate and they're well thought out, they sort of reduce the infections. But also, Mombasa hasn't really had a lot of exposure. Once the borders were closed, once travel was halted, then the exposure was what within that community, and what they may be able to achieve is flatten that curve. I would expect, unfortunately, that other counties other than Mombasa and Nairobi, because of this reopening and because, as Kenyans, we didn't heed the call to stay in our principal centers, I would expect in the next couple of months to see significant spread in the counties outside of Nairobi.
Right, and I want us to take a look, because now you took us to the conversation around reopening. I want us to take a look at some of the numbers that we can look at the trends that we've seen since the 6th of July when President Kenyatta relaxed some of those containment measures. Let's take a look at those. And we begin, do we have them? Right, so let's put them on air that since reopening, which is the 6th of July, we have had testing of 87,152 samples. Out of that, 9,717 have tested positive. That's a positivity rate of 11.14%. The deaths since July 6th have been 120, pretty higher than even the month of June. If you're to look at the total new infections since 6th of July, they have been at 9,717. So this is the total new infections since reopening. All those, out of all that, more than 60%, that is 6,162 are in Nairobi, 807 are in Kiambu. Kajiado has taken 646, Machakos 548, Mombasa 327, Busia 219, Nakuru 202, Migori 126, and Uasin Gishu 103. And this is important because previously some counties that were at the borders were the ones that were leading. But also there are some notable counties because the case load may not be as high. but the increase has been pretty significant. If you have to look at Makueni, before the reopening, we were at 42 infections. Now we're at 113. So that's an increase of nearly, what is that? More than 71 actually. Nyeri County had just 9 cases. Now that has gone 7 times higher to 66. Kericho had 10, now they're at 49. Laikipia had just 3, now they are at 40. That is more than 12 times, actually more than 13 times. So, Dr. Masika, when you look at all these trends that we are seeing in these counties, do we now have any evidence that reopening has had an impact, and especially in the counties neighboring Nairobi and those that are far off like Nyeri, Laikipia and the rest?
Yes, there are 2 issues here, and one is reopening and the other is the natural spread of the disease. We expected when we reopened to have a side effect, so to speak, and the side effect is the increase in numbers across the counties. But also once a county has 1 or 2 cases, what we've seen in the past that is just a tip. And with time, this tends to spread across the same county. You remember not too long ago, Nairobi had 1 case. Now you can see where we are at. So there are 2 issues here. One is the movement, which is increased. And when we reopened, I think the message that people should have received is that we are not yet safe and people should not move as much as unless it's necessary. But we've seen a lot of movement, and even within the counties themselves, we've seen a lot of movement, which increases the spread. And if you look at some of the counties, really, places like Nakuru, there are hubs of transportation, places like Eldoret and these other places, or Sengishu, that is, these areas that act as hubs or centers of local transport seem to have gotten quite a surge. So that means we have, yes, spread some infections from Nairobi to the counties, but once the infection is in the county, it takes a life of its own. It's able to spread depending on the behavior of the people in that area. So really the idea should be, we have COVID across all the counties in the country except maybe 3. And if we assume that everybody is infected and take the measures, then it will not be a matter of which county is worse hit. It will be that COVID is here with us, and anywhere you are at risk. You need to take the measures in order to prevent yourself from infecting others or from getting infected. And Dr. Ngani, so you look at all these indications that would appear that since reopening we're having these effects coming up, but do you think the numbers are telling us the real picture of the situation in the counties and the regions? Are we at that point that you can say now we know where the disease is?
Actually not, because I think the county that's testing the most is Nairobi. Many counties aren't testing well enough, and I think the same applies to the whole country. The numbers that we are looking at right now are actually lower than the actual situation. Number 2, there's a bit of a lag between the time of infection and the time you see the impact. So if reopening has an impact, that impact is not what we are seeing now in its totality, but a couple of days from now, maybe 14 days. The general concept is whatever numbers you're seeing on a given day, consider the situation to be 14 days behind, meaning that we're actually worse off today than we are. But I don't want us to lose what Dr. Masika has said, which is that there's a natural progression of this disease, so that a few cases within that county already mean there's going to be community spread, because by the time you pick 1 patient, there are probably 8 others that you have missed in the community who are asymptomatic and who are going about their business, spreading the disease in the community. And this is the real risk. Let us understand that COVID is here, and wherever you are at high risk of contracting COVID. And therefore, what do we do as a nation to mitigate or lessen the impact of COVID-19 in terms of death, in terms of mobility, and other factors that affect society?
And of course, now we know surely that the positivity rate is high. The Ministry of Health officials, some of them have been saying that they are concerned by this. I know Dr. Masika sometimes doesn't agree with that because he feels that we are better at targeting. But even as we respond to that, now you're more likely to catch the virus now than you were in March. Now let's get back to the basics. Dr. Masika, if you test positive today, whether you have symptoms or not, what are you supposed to do? Well, what we've seen now is a move towards home-based care, that testing positive does not necessarily mean you will go to hospital isolation. You can do home-based isolation, which after assessment, that is, you qualify for that, is less cheaper and also less disruptive to your lifestyle. And what this means is that you are either asymptomatic or having mild symptoms. You have no underlying conditions that will put you at risk of severe disease such as hypertension, diabetes, or asthma, and such other conditions. You also have a space at home with a caregiver that can take care of you, and no one else at home is at risk.
And this allows you to stay there safely without putting other family members at risk.
Right.
And there are different issues that are looked at in the space that you are at. Are you able to get enough water? Are you able for sanitation, for cleaning your hands? Are you able to get food? And once that is confirmed to be safe, then you can stay there for 14 days under isolation in your own room, if possible, even using your own utensils and bathrooms. And the person taking care of you should be well protected. And so that allows many more people to be taken care of in their own spaces. But where somebody requires admission is where they have either an increased risk of developing severe disease, or they cannot get in a good space or an appropriate space for home isolation, which means then they have to go to facility isolation. And I think this is being approached by different counties differently. Each county, depending on their means and their preparations, they have different facilities for isolating persons who have to be at a facility, so that you try and reduce the exposure to others while you provide the care that these persons need. Some of the people, we've seen most of the people are asymptomatic. Some of them do require care, and unfortunately for some of them, when the care is required, if they're at home, it turns out to be too late because it affects the breathing system. And if you are not able to breathe properly, you have a very short window to get the right intervention. So if you are far away from a hospital and you have this severe disease, it becomes quite a risk to your life.
Right, and Dr. Ngani, so when I'm looking at some statistics, some recent statistics that show that part of the symptoms that have been seen, of course, just 10% are symptomatic, 90% are symptomatic, but among those 10%, the cough has been the most predominant at 53%, fever 41%, difficulty in breathing 29%, and headache at 15%. The rest are below 10%, including sore throat. So where do you draw the line between home-based care and when someone needs now to get to the hospital to be taken care of?
Principally, the main issues would be when you have difficulty breathing setting in. That's the time when, for sure, you must have the care from a health facility. It may mean that you need a bit of oxygen. You may have some need for high level of management for your symptoms that can be very severe. But then also at the end, you may end up requiring a ventilator. You may require a critical care support. And this is really the point where the severity of the disease becomes manifest. But I didn't want us to lose a very important point of what Dr. Masika was saying earlier. I think realistically, we need to think of transitioning towards protecting the vulnerable in society. Who are these vulnerable people? Advanced age, we say 65 years old, new recommendations are coming down to 60 years. People who have pre-existing conditions such as diabetes, high blood pressure, cancer patients, anything that lowers your immunity. And because in this particular category, most of them are not really, a huge proportion of them are actually getting hospitalized, and the risk of mortality in this group is much higher. And what then do we need to do? As citizens, we have to understand that it's upon us to protect the people who are vulnerable. And I see hospitals now having fights with patients where some patients are even asking for referrals out because they have been denied access to visit someone who's in hospital. Please understand, someone in hospital has a disease that's ongoing, that's affecting the immunity. And we talk about, huge traffic jams coming from the up-country areas, other counties. And I think as a nation, we have to be very deliberate and very intentional in our steps to protect the vulnerable, meaning we limit that exposure to those who would suffer a significant disease.
Right, and Dr. I'll get back to you when it comes to caring for the critical patients or patients that are in critical condition. But Dr. Masika, so here you are, you have gone for targeted mass testing, or because you are part of the contact tracing, you've been identified for testing, and you go, you take a test, then you have tested positive. Now you're in shock, you don't know what to do, you're receiving so much information, take a lot of vitamin C, take a lot of dawa, a lot of ginger. Which of this is true?
That's true. There's a lot of anxiety around testing, even before you get your results. And once you get it, it's positive, yes, it can be quite stressful. And the idea really is not to take all these supplements that people have recommended. If you are asymptomatic and you're at home, the idea is to stay healthy. This means a balanced diet with enough fruits and vegetables. Whichever fruits you can get are healthy. If you have a problem with sleep, that could be a challenge. So you need to have enough sleep, enough diet, and if possible, some exercise, so that you remain healthy sleep enough, and eat well. There are a lot of recommendations for many supplements that are going around, and many of them are exaggerated or claim to be doing miracles that they really cannot do. And the idea is, if you're taking supplements, you do not know whether you need them. Maybe your body already has enough of that. So get some sun, that is enough for your vitamin D, 15 minutes a day with enough skin exposure. Require vitamins, supplements, it should be through prescription by a doctor, because there are actually people who have deficiencies or have shortages of these vitamins in their systems. But generally, if you're eating well and eating enough fruits and vegetables, you should be able to extract these vitamins as you require them in the body.
I have not conducted any study, but I have reason to believe that there is a higher demand for vitamin C, a higher demand for lemon. So you're saying that all this is not necessary? Does it help even for someone who has not even been tested for COVID to boosting their immunity?
The idea, as I said, is to extract this from fruits. Taking supplements most of the time can be wasteful, because if your body has enough of this, it will not be absorbed. It will just go through your system and get excreted. So if you really require or feel that you require vitamins, you need to be assessed so that people can confirm that you do require supplementation. As I said, a few people may require this, but for you, the best supplement is, if you feel you need vitamin C, take it from fruits, lemons, oranges, whatever other fruit that you can get that is accessible to you is good for you. Rather than focusing on the supplements, I would rather we focus on the fruits. And there are many fruits in season every time. And when a fruit is in season, it tends to be affordable to many people. That would be the best, rather than buying supplements, which your body may not need. And as I said, for most people, it will just go through their system without being absorbed.
And therefore the question, Dr. Ari, because yes, all people will do all this, whether they are taking supplements on prescription or not, or people are taking more fruits now because of the fear that they have. Is there any evidence that it works to help your body better deal with COVID-19 should you have tested positive?
Yes, if you are taking healthy foods with enough fruits and having enough sleep, dealing with your stress in a healthy way, meaning you don't rush to use drugs like alcohol to fight your stress, your body is basically much better to deal with any infection, not just COVID-19. So for somebody who is having a healthy lifestyle, meaning you have some exercise, you have good food, you have good food meaning healthy, not necessarily what Kenyans call good food, and also enough fruits and vegetables, your body is better able to deal with any infection, because it is not under stress. It is healthy, and the immune system is strong. But the idea of driving people towards supplements to achieve this is what is misplaced, because then it takes resources from what you really need to do, which is healthy, balanced diet.
Mm-hmm. And Dr. Ngani, so we have seen that about 51% of the total fatality case in the country have had comorbidities. That is based on the data that is available. Most of them, about 32%, had both diabetes and hypertension. Why does this disease target these people that have these pre-existing conditions so bad?
Yeah, so the first issue is just basically the body's ability to cope with a new infection. Number two, there's an issue about decreased immunity. And number three, there are some special mechanisms relating to certain receptors within the lungs that have been shown to put you at greater risk of getting a severe disease. And that when you get the disease, then in fact your body's processes are much inhibited, and you get difficulty breathing pretty quickly, symptoms that are distressing and actually being at risk of death. And this has been shown in multiple studies, yes.
And we know that in the protocols for home-based care, those people that have pre-existing conditions have been disqualified from that. But where do you draw the line? There are those who would have probably mild diabetes or hypertension. There are those that would have severe diabetes or acute diabetes. Where do you draw the line? Who can take chances?
Well, I don't think at this stage, if you have a chronic illness, then you can take chances at all, because what Dr. Masika has said is actually the reality of it, where you have this group of people who they are just walking about, but their oxygen level is extremely low, and they're going to sudden collapse. Beyond that, I think we have to be very careful, because the number of critical care beds available, number of hospital beds available to COVID, declines every day. So if you're at home and then you wait for significant symptoms to come in, then you may not get it when you really need it. And so if you have these pre-existing conditions, then please link up to care early. And then also it reduces the risk of certain exposure, certain medical risks that you'd undertake if you do not take these measures early.
And Dr. Masika, I know that Dr. Ngani there indicated that once you have difficulties in breathing, you should get yourself into a hospital. Your loved ones can get you to a hospital. How exactly do you do that, especially for people? We have a case of Dr. Lugaliki who passed on a few weeks ago, and she passed on without, she hadn't known that she had a case of diabetes. How do you tell this? Because, I mean, people have pre-existing conditions without knowledge. So what are those telltale signs that you must look out for?
Yes, I wouldn't want to go into the details of Dr. Lugaliki's death because I have no information at all. I don't know what she had other than COVID. But I would like to say that if somebody has any issues in shortness of breath, basically you feel like you have air hunger or you're gasping, struggling to breathe or to get enough air into your body, that really is a sign that you need help. And what you should do is call a hospital that you feel is best for you, either nearest to you or where you have an arrangement, or where you can access care easily from where you are. And when you call them, you will be warning them that you have these symptoms. And because they are COVID-like symptoms, even if you don't know that you have COVID at that time, they will prepare for you and advise you, if possible, if you need to go to another hospital, so that by the time you arrive, you are able to be picked up, and also protecting the healthcare workers that you will meet there and other patients who might be in the waiting area. If there is no, if you are not able to call and you have to go to the hospital, say because you are alone or it's an emergency, then at the hospital you need to warn the people you find at the waiting area to receive you what you have early enough so that they can take the measures to help you. So the idea is to be very vigilant about your health, and any problem that threatens your breathing, that you feel you have issues breathing, and even if you've not had any other symptoms, is really one that requires that you go to hospital immediately and not wait until the last minute.
Right, and Dr. Ngani, so looking at the numbers, that those that had diabetes alone were at 15%, those that had hypertension alone was 17%. So if you do the calculation, 32 plus 17, you can do this with me, is 49, plus 15 is about 64. So 64% people that died, they either had diabetes or hypertension or both. What sort of care are you according these patients, and also the COVID-19 patients that are severe? What sort of care are you according them, knowing that too well that so far there are 67 people in ICU and most hospitals are reporting fullness to capacity?
So a couple of things that are unique, and I think this is not just the healthcare workers and hospitals, it's upon the individual and also the people around them. Number one, we are urging them very strongly to be very careful about where they go, what they do, and who they meet with, because it's literally a matter of life and death. That's number one. Number two, to limit exposure outside, meaning that you would stay in a facility, you'd stay home unless you really have to go to. Then number three, even when you have to visit a hospital, see if you can do that off-peak. Talk to your doctors so that you go at a time when there are very few people, but you have decreased risk of contracting COVID. Then you also have to get your medication and keep it for a longer period of time. So if you have medication, instead of taking 1 month, you can take 3 months, for example, which allows you to not have to go out as often as you ought to. A very important, compliance. There are many diseases where you really have to make sure that you take your medication without skipping, and be as consistent as possible. This is part of your best chances. Then all these measures that have been spoken about, for someone who's at risk, then these are areas that you have to be extremely careful about. Number one, ensure that you're doing your hand hygiene, you do the social distancing when you're in a public space, wear a mask, and preferably for this population, we're recommending that you use the N95 mask, because that's the kind of mask that will protect you. So for people who have these special conditions and those who have who work in healthcare spaces, then you really want to take extra measures.
Right.
In the hospital setting, then of course, there are certain protocols that are standard for COVID-19.
Okay, Dr. Victor Ngani, Dr. Moses Masika, we wish we had more time to continue this conversation, but unfortunately that's our time for now. We'll have this again as soon as we can, to be in a position to continue informing the country and the people on what they need to do when they test positive, as well as those that have pre-existing conditions. But I think the take home here is that if you have diabetes, hypertension, or both, or whichever other pre-existing condition, you need just to stay at home unless it's very necessary to leave your house. We take a short break. On our return, we'll be speaking to two senators, Senator Ledama Olekina and Senator Samson Cherargei. We'll be talking about the conversation around the revenue standoff. The senators cannot agree on how to share the 316 billion shillings to the 47 counties. That formula is in contention. We have that conversation shortly.